So we are here in Belgium, in Sint-Niklaas, and at the end of our seminar, we'd like to ask a little question about the book. You have already published the book Homeopathy Patterns in the Periodic Table.
Yeah.
And now there is another book, and could you tell us a little bit about it?
Okay. I'll tell you about both the books. Yeah. First, I'll tell you about the first book, which is Homeopathy and Patterns in the Periodic Table. And it is a book that is from our practice, from almost 7 to 8 years of our practice. And the book is mainly on the periodic table and the first 3 rows of the periodic table. But to begin with, it has the understanding of the 3 kingdoms, and then it has our understanding of how we come to the 7 rows, and it also has a connection to the Materia Medica from the rubrics, how we have derived the understanding of the 7 rows. And then from the 7 rows, we go into especially the first 3 rows. And it has every element of every column, and it explains the state, yeah, and the main sensation and the themes of every element of the first 3 rows. And it gives everything in detail so that you can even differentiate between 2 elements. Let's say you want to differentiate between nitrogen and oxygen, or sulfur and phosphorus, so you can differentiate as you go along. It also has a section on salts. Yeah, when do you prescribe salts in the periodic table, and how are salts different from individual elements? And another important thing that it has is it has a whole section on noble gases. So it has all the 6 noble gases with the main sensation, with cases of each noble gas, with themes and differentiation of noble gas from several other elements and several other similar looking remedies. So that is mainly the first book.
So you recently published a new book. Can you tell us a bit about this new book, please?
This new book that we have published, No Suits and Imponderables Come Alive, this book has been primarily based upon our work on the no suits and the imponderables. Over the last decade, using the approach that we have been practicing in our clinic, we have found out different ways, deeper ways of coming to no suit prescriptions. The conventional way of prescribing no suits would be like an intercurrent, but we were able to establish a clear understanding as to how a no suit can be indicated and used in a case with precise indications. And we have explored that entire phenomena in this book, where we have written about all the no suits, the miasms, the remedies made from them. Along with that, we have explored various cases which bring alive this entire concept. One of the chapters in this book also has been dealing with the miasms. We have tried to understand miasms from Hahnemannian time to the way that we are using miasms today, and how we can make more easier or simpler sense of the whole approach. Our take on miasms, our understanding and correlationships between various miasms, which comes as a very handy tool when we are dealing with miasms in our cases, and it really helps us simplify our practice.
And one very interesting thing that we have put in this book, which has never come before, is the whole understanding of miasmatic relationships. When I say that, I mean miasms, how they are related to each other. Yeah, we have used the sensation method, and we use the 10 miasms, yeah, from acute to SORA to ringworm, malaria, then psychosis, then tubercular, cancer, leprous, and syphilis. So these 10 miasms. But we have established a relationship in between the miasms. For example, we've made a first half between acute to psychosis, and then a second half between psychosis to syphilis, and then we've described how miasms that fall in the first half are actually related to and intensify in the second half. So that is a very new, a very interesting and a very revolutionary but a practical understanding of miasms. And then of course we have the imponderables, our understanding of imponderables.
I think imponderables, just like noble gases for us, have opened up a big window into this unexplored or little known portion or kingdom in homeopathic world, having very interesting cases where our patients have helped us understand the imponderables. We have explored that understanding further, looked into many more cases and studied various phenomena to understand what are imponderables and how do they behave with homeopathy. How well can we use these imponderables in treating our patients and giving those results. All that exploration into this world of imponderables with clear, simplified understanding, as our work is always, we have put it together in the second half of the book. And since Bhawisha and I enjoy simplifying things, both of our books, the first book as well as the second book, is filled with many charts, many easy reference charts. And since we love to simplify things for ourselves while we are working, we love to present the same to our readers, to our viewers and people who use our work in their practice. So there are many handy charts in both the books which can help you at a glance understand the whole theory.
To make differences, to make comparisons, and also the style of both the books is very simple and almost fluid, like you are reading or you are talking to somebody. So it's a very easy style.
In the upcoming RadarOpus, you have created some new charts. Can you tell me something about it, please?
Yeah, sure. I think first and foremost, the charts give you an idea of how we think and how we work. So if you have a case and you come to a basic sensation or a core issue, and you understand it, then you can compare that issue with the charts given, and you can see if this case belongs to the kingdom. So the first chart is about differentiating whether the patient belongs to the animal kingdom, the mineral kingdom, or the plant kingdom. It's also based on the book. Now, so the first chart is, let's say it's the I and U. So here it tells you about what is the patient going to say if he's in the animal kingdom, what is he going to say if he's in the plant kingdom, and what is he going to say if he is a mineral. How will he say about himself, how he exists, how will he say about what he needs, and how will he express. So that's the first chart that helps you decide which kingdom the patient belongs to. Then of course we have the second chart, which is the 7 rows. And this talks about the 7 rows and how each row presents itself and explains itself. So you have the issues here, and you have the words of the row and the theme. So if your patient belongs to the first row, these you can see if he has these theme or these words, and so on and so forth. So if he belongs to the second row, then what will be his main issue? The main global theme in the case will be, can I be on my own without anybody else? And then related words and related themes. And if he's in the third row, then it will be about his identity, his own acknowledgement, and related words and themes. So like this, you can go up to the 7th row and see if your patient falls in any of the 7 categories.
Okay. Left and right.
So here we explain or simplify that if he is, now you've understood the rows, and you want to know on which side of the periodic table he belongs to. So this makes it just easy. Is he on the left hand side? Then he's more dependent and he's barely begun. Then these are the words that help you to determine if he's on the left or if he's on the right.
Right side.
Then there is a more detailed chart which is about the first 3 columns, because specifically the book is about the first 3 columns, yeah? I'm sorry, not the first 3 columns, the first 3 rows of the periodic table, but it's about the columns of the first 3 rows.
Okay.
So each element, you have 8 elements, you have only 2 elements in the first row, and then you have 8 elements in the second and the third row. So this is about how each element, you have the columns from 1 to 8, yeah? Or rather I would say 1 to 18, because that's how we put it in the periodic table. And this is about each element and each column, how will they speak if they are in that column or in that stage.
The language.
The language.
Yeah. I think the graphs that we have put in over here are a simplified version of the contents of our book, The Homeopathy and Patterns in the Periodic Table Part 1. And it gives a nice overview about the work. At the same time, it's a very useful tool for practitioners who can pinpoint these sentences, these phrases spoken by their patients and quickly come to the remedy, rather than being lost in the plethora of words generally generated by our patient and in various books. This is a very simplified version to come to the point.
And a quick way to come.
Yes, and at the same time, it's a quick comparison. For example, you are not sure whether your case is in the 15th column or 16th column. So then you look and you say, okay, in the 15th column, there is more of explosive. You see reactivity down here? And you say the reactivity of column 15 is more explosion, whereas the reactivity of column 16 is more exhaustion, and the reactivity in column 17 is more erosion, exhaustion, explosion, all put together. So then you can determine whether you want to give 16 or 17 or 15, yeah, like this. So it makes this comparison, makes it more easy at a glance.
Simplified technique. And since this is the 21st century, where everything that we do is put up in a very simplified way, I feel this is a nice tool to have books in form of the e-version, which are very apt for people for a quick referral and instantaneously refer to that section in the book where they can read about it and educate themselves and can be very sure of the prescription.
Yeah.
Very nice. Thank you very much for coming and for explaining it to us. It was very nice.
Thank you.